back, everybody. You know, changes are coming to Medicaid. Eligibility checks are happening right now for the first time in 3 years. Today, Mike Berto, a healthcare economist and the author of the Straight Talk blog, he has stopped by to explain what this means for some people who are enrolled in the plan. Welcome back, Mike.
Thank you, Malik. It's a pleasure to be here.
Yeah, we're always talking about Medicare, but I love that we're talking about Medicaid. Okay, what is exactly happening with Medicaid coverage right now?
Well, as of now, there are over 2 million people in Louisiana who are covered under the Medicaid program. 3 years ago, the federal government, concerned about COVID and all the unemployed folks, said to the state Medicaid programs, if you leave people covered continuously until the public health emergency ends, we'll give you some extra money to cover those expenses.
Okay.
Well, the PHE is ending on May 11th.
Ooh.
And so for 3 years, nobody on the program has had their income checked or their residency. So now they've got to clean up the books, so to speak. And so they're checking incomes on the entire population. There's a pretty good chance a lot of people are going to lose their coverage.
Oh no, so for people who are under Medicaid right now, like what advice can you offer them?
It's critical that the people on Medicaid today have accurate, up-to-date contact information, both with the Department of Health and with their Medicaid managed care organization. If you got a Medicaid card, you flip it over, there's phone numbers and a web address on the back. You go straight to them and make sure they have your current address, phone number, email address, so they can send you a text, or they may have already sent you a pink letter in the mail. They're pink, and they're designed to alert people to the fact that changes are possible right now.
It's so important, everybody. Look out in the mail for those pink slips. And you know, for people who are wondering, like, what does a check look like since it hasn't happened in 3 years? They're checking your income, your residence, all of that?
Yes. For a single person who makes more than about $21,000 a year, Medicaid is not really supposed to be their plan of choice.
Okay.
So they're going to look at incomes historically and try to project that out. For a family of 4, the number's about 42,000, right around there. If they make more money than that, they may disqualify them from the program. What we want to make sure people understand is you have other options.
And let's talk about those options, because for people who maybe are making more now since they did when they were first on Medicaid, like, what can they do? What are the options available?
Well, I believe most of these folks will be employed, and so the first line of defense is really to talk to your employer, see if you can get on your employer's plan. If that turns out to be unaffordable, you always have healthcare.gov as a fallback position, where we have the individual marketplace. They will let you start shopping 2 months before your Medicaid ends, and they'll let you continue to shop for 3 months after your Medicaid ends. So plenty of time to make a decision. Enormous amounts of federal money available for you to draw down and help with your premiums. All of that will be active. It already is. It's running right now.
For people who are wondering if there is an employer option, but for some reason the healthcare.gov option is cheaper, can they go with that option, or do they have to go with their employer?
It depends on how much the offer costs. There's actually a feature on healthcare.gov that allows you to test the offer your employer gives you, especially for your dependents and your spouses, right? And then you can take that offer online and test it, and if the website says, we don't consider this affordable, it'll open the website up and you can shop and draw all the tax credits you're entitled to.
So know your options, everybody. It is so important. Now, for people who are on Medicaid right now who are like, I'm waiting for my pink letter, but I haven't gotten it yet, how do they contact the people because they still qualify for Medicaid?
Absolutely. You shouldn't wait. You should reach out to the Department of Health, reach out to your provider that's on the back of your card, and make sure they have the most current information, your phone number, your mailing address, and your email address. They're even sending hundreds of thousands of texts to people to try to get them to call them back. The last thing you want to happen is to be disconnected from Medicaid because they can't find you.
Correct. Absolutely, it's so important. And for people who are wondering, when is that last date that they're going to be checking for Medicaid? Give us those dates one more time.
Sure. We expect the first disenrollments from Medicaid to happen on July 1st. But it's going to go on for a year. They're going to test and and disenroll maybe 20,000, 25,000 people a month for the next 12 months starting in July. So there's going to be an ongoing effort to do outreach and make sure these people know that they have options. It's not the end of the world if Medicaid ends.
So true. You all are seeing all the dates on your screen right there. Again, if you have updated contact information, make sure you call the number on the back of the card so they get the right address, okay? Thank you, Mike, for being here and joining us this morning. And look, if you want more information about the Medicaid changes, head over to his blog, straighttalkla.com. You can also log on to getplanoptions.com to get connected with an agent, or you can call 1-844-GET-BLUE. They will help you out.